my name is Kaci Flohre, and thank you for joining me for this guided reflection. In this video, I'll be reflecting on the end of program student learning outcome number 4. This outcome states, examine the use of information technology to promote the delivery of safe, quality nursing care. In this video, I'll explain what this outcome means to me, how the course learning outcomes have helped me achieve it, and how the core assignments in this course have contributed to my professional growth as a BSN prepared nurse. To me, this outcome emphasizes the importance of using technology not only efficiently, but also with intention and ethical awareness. In this course, I've come to see technology as a crucial part of how we ensure patient safety, improve communication, and apply evidence-based care. It's not just about the tools we use, it's about how we use them to better support outcomes. Smith and Jones 2024 explained that well-designed electronic health record systems directly improve medication safety and usability for nurses, which directly aligns with my clinical experience as a med-surg nurse who uses Epic documentation frequently. Now moving on to the 3 course competencies I have selected. For my first competency, I have chosen the competency that states, utilize patient care technologies, information systems, social platforms, and communication devices that support safe, effective nursing practice to maximize healthcare outcomes. This competency gave me the opportunity to strengthen my technical skills with Epic, barcode scanning, and telemetry monitoring, tools that I use every shift. Now, beyond just using them, I've learned how these systems actively support patient safety. For example, telemetry can detect subtle cardiac changes quicker than I can, which is better for patient safety outcomes. And then scanning medication prevents medication errors, of course, such as overdosing patients or even giving them the wrong medication. I have also become more confident in using Epic to track patient mobility, monitor trends not only in labs but in vitals, and then to ensure interdisciplinary teams are all well informed. These technologies support safer, more coordinated, and accountable nursing care. My second competency I chose states, utilize self-care to practice in a mindful and resilient manner. Reflect and modify professional practice according to ethical, moral, humanistic, and legal principles. Now, this reminded me that we use technology and must always reflect professionalism and ethics in the way we use it. I thought a lot about protecting patient privacy and how we use this technology when we're using shared workstations, entering data, and reviewing sensitive information on devices. We have mobile computers now, mobile workstations. When you're giving or receiving port, do you think you should be using a shared workspace, or do you think maybe you can take your now mobile computer and do it somewhere private, and now you have just protected the patient? I also considered how technology can be misused in education and in practice, and how important it is to use it with integrity. This competency deepened my understanding that ethical practice includes how we interact with information systems that protect patient data every step of the way. Now, my third competency I have chose states, demonstrate intentional collaboration and respect for the perspective and experience of other team members to optimize healthcare and strengthen outcomes. Now, this is my favorite competency that I have chosen. This competency helped me improve how to use technology for interdisciplinary communication. I learned how to use Epic's secure messaging features and shared notes to better coordinate physical therapy, case management, and other providers. I started making sure my documentation was just not complete, but useful to the rest of the care team. Now, what I mean here, we as a healthcare team, we are people too. Not the same person will be taking care of this patient every single day. Some nurses work just one shift, one 12-hour shift. That's all they have with the patient. And then not everything gets communicated all the time. As much as we try to report, the electronic health record is a tool. Everybody can see your nursing note. What you share is invaluable to the next person coming on. So it's important when we round with doctors, when we speak with PT, that we include goals. When we're speaking to consulted physicians, what did they share that is important for the next nurse, doctor, whoever reads your note? Because this is how we're going to protect our patients. This kind of tech-supported collaboration reduces delays, prevents errors, and ensures everybody is working towards the same goals. It showed me how technology isn't just about data. It's about connecting people across roles to improve outcomes, to better improve patient safety and outcomes as well in the hospital and everywhere, actually. Now, moving on to the core assignments. The core assignments and how they contribute to my professional development. Each of the core assignments in this course helped me grow in my understanding and application of technology in the nursing practice. My personal philosophy of nursing assignment helped me define what matters most to me in nursing. I reflected on the 4 meta-paradigm concepts: nursing, person, health, and environment. Through this assignment, I added my own 5th paradigm, clinical competency. Well, meta-paradigm. I shared real examples from my own practice where I used Epic, labs, and imaging, so my own clinical competency, to detect DVT and bowel obstruction. Those moments showed me how my values, critical thinking, and use of technology all work together. This assignment helped me see that technology isn't separate from care. It's how we deliver care that is accurate, timely, and ethical that helps improve patient outcomes. Moving on to the annotated bibliography for the evidence-based project. This helped me build confidence in using technology to conduct research. I used databases like the CINAHL and PubMed to find peer-reviewed studies that aligned with my PICO question, the benefits of early ambulation as opposed to delayed, where I refined my research using filters, keywords to find the most relevant and high-quality evidence to support my PICO question. This process helped me see that technology is not only critical at the bedside, but at the beginning of every evidence-based research project there is out there. Now, if there is one thing to be said about nursing and anything in the medical practice, is that it is heavily influenced by evidence-based research. One of my resources here, SHE 2025 reinforces this by showing how informatics tools lead better safety outcomes in critical care by improving clinical decisions and communication, of course. Finally, moving on to my interview paper. Here I interviewed a new Lake Sumter part-time adjunct. Now, this interview gave me a broader perspective of the role of technology both in education and in practice, because I spoke with a BSN-prepared ICU charge nurse who adjuncts part-time. He shared how the simulation labs, the electronic health record training environments, and virtual clinicals help prepare students to help them deliver safer care. Now, one of the biggest things that I can point to, because one of our assignments that we had earlier this week were Nurse Jax, he said 33% of our nursing care is through technology, and that is a large part of what we're not taught in nursing school. Well, as somebody who graduated from the RN Bridge in spring of 2025, I can say that's not true anymore. Our simulation labs, we had live changes in telemetry for a simulation patient. We had access to calling a doctor, and we had access to an electronic MAR at bedside with a full patient history, full labs, full vitals, everything that was being updated in real time, stuff that we have, everything that we have in practice minus what was actually, it doesn't have a real Epic system, but it is just as close as what you'd see if you had to do a cumulative of what all the electronic health records are. Now, this interview, it helped me realize how essential it is to teach nurses not just what to do, but how to use technology thoughtfully and responsibly. and it inspired me to think more seriously about my own role as a future educator and mentor and how I can help others grow in this area, because I would like to move on to education once I have my bachelor's. Together, these assignments didn't just teach me how to use technology, they helped me understand why it matters. I see technology as a vital part of how we improve outcomes, protect patient safety, and support our teams. It's something I approach with more confidence, purpose, and ethical awareness because of this course and this learning outcome. Overall, this learning outcome helped me realize that technology is not just an accessory in nursing, it's a foundation in modern care. When used with skill, ethical awareness, and evidence-based purpose, it becomes one of the largest and greatest tools for protecting patients while also promoting patient outcomes. This course has strengthened my ability to use technology confidently, responsibly, and in ways that align with my values that I hold as a professional nurse. With stronger informatics and clearer understanding of my ethical responsibilities, I feel more prepared to lead and support positive change in the digital healthcare environment. Thank you for being a part of my guided reflection.